Okay, good afternoon, good evening, everybody. Thank you for joining the Foundation for Cancercare's webinar series. My name is Amanda, and we'll just wait a few minutes, 5 minutes, to have others join us before we begin the session for the day. Thank you again. Okay, welcome once again to the Foundation for Cancercare's webinar series. My name is Amanda, and it's an amazing day, and it's great to be with everyone here. And I hope everyone has been having a good day as well. Okay, so we will begin now, and we will just start with housekeeping rules and introductions. So first of all, I would like everyone to be muted, and when you have to speak, you can unmute. Should you have questions, comments, or suggestions, you can drop them in the chat box, and we will pick it up at the end of the session during the Q&A session. And, let's try to make it as interactive as possible when questions are thrown at us and asked, just try to make it interactive. If you find any part of the session, interesting and useful, please, you can tweet about it and use the hashtag Foundation for Cancercare, or you can post on it on your Instagram, Facebook, or LinkedIn. And you can also use the reaction buttons on your screen as well to, probably give a clap for a speaker or a thumbs up, whichever is fine by you. All right, so welcome once again to our webinar titled Financial Wellness Cancercare, Strategic Planning for Health Screening and Treatment. So we will start with our introduction, a brief introduction about the foundation that will be taken by Tolulokpe Adiola, who is the manager at the Foundation for Cancercare. Tolu, over to you.
Good afternoon, everyone, and thank you once again for joining us in this webinar. We're glad to have everyone here. So I'll just be doing a brief introduction about who we are at the Foundation for Cancercare. So we are the non-profit arm of Lakeshore Cancer Center, and Foundation for Cancercare actually commenced operations in 2021. And our vision is actually to promote comprehensive cancer care in Nigeria and in West Africa with a focus on prevention, treatment, and regional cancer control. And basically, our focus areas include education and awareness. So one of the major things that we do is education and awareness. We use all platforms available to us to educate the public about cancer. We use our webinars, we use our social media pages, we use our educational materials, which we distribute, everywhere we go in different communities, at conferences, just to ensure that people are constantly being educated about cancer. And we've been able to reach over 12,000 people through our education and awareness efforts. And of course, we do a lot of community level screening where we take cancer screening to different communities. So breast cancer screening, cervical cancer screening, and more recently, prostate cancer screening. So we've been able to reach over 1,000 people with our screening services in different communities. We have been able to reach about 15 different communities since we commenced our operations. And we also provide support for treatment, specifically radiotherapy, to individuals who cannot afford to pay for their care. Some of them have reached financial toxicity. They need support, either to balance their payments or even make the full payment. So Foundation for Cancercare also provides this support to cancer patients, and we have been able to support about 21 patients since we commenced operations. And we also provide support to cancer patients through the Dewdrop support group. Now, the Dewdrops is actually the support group for Lakeshore Cancer Center, which is managed by the foundation, with over 100 members on that group. So we have, meetings on a monthly basis where everybody just comes together, share the burden, provide support to cancer patients as much as we can. So, these are some of our focus areas. And of course, we are also big on fundraising because, we can't really do our work without funding. So we actually have an annual fundraiser, which is called the Swing Against Cancer fundraiser. We held the maiden edition last year, and we hold these fundraisers both in Lagos and in the USA. So we've held the second edition for the Lagos tournament this year, and we are looking forward to hosting the USA edition in August this year. So we're really looking forward to that. And of course, the foundation is going to be hosting the maiden edition of its charity gala. So we are really excited about that because this is the first time we'll be doing that. but we are hoping to be able to raise funds to be able to continue supporting cancer patients because, that's the focus of what we do. And of course, to be able to take cancer screening into different communities all around, not just Lagos, but neighboring communities and even communities that are afar off. So this summarizes what we do at the foundation. You can follow us on social media. We're on all social media platforms, on Instagram, Facebook, Twitter, YouTube, just to have a feel of what we do. One of the things that we also do is that we go to secondary schools and, we provide education to them. So if you follow our social media pages, you'll be kept abreast, as to all of the activities that we do at the foundation. So I'll put a pause on it here and hand it over to Amanda. Thank you so much for listening.
All right. Thank you very much, Tolu, for that in-depth introduction of the foundation. As Tolu rightly mentioned, we do a lot. And one part that we can't do alone is get the funds that we need. So from time to time, we host fundraisers, and we don't just do it alone. If you would like to fundraise on our behalf, we're also open to, collaborating with you to also fundraise for the work we do at the foundation. All right, so now we would move straight into the webinar for the day, which is themed Financial Wellness in Cancer Care. We'll be looking at strategic planning for health screening and treatment. So one of the reasons why we put this webinar together was born out from a support group meeting we had earlier this year, where we talked about finances and, cancer care treatment and support. And a lot of questions came up around how to manage finances, where to get support for treatment. Tolu mentioned we support cancer treatment. We support radiotherapy primarily, but cancer patients also need support, with chemo and other forms of treatment, including medications. And many of the times it's, the burden of the finances is very deep into the pockets of the families and caregivers of these patients. And many times they need other sources to, help them. So the reason why we're doing this today, is to provide you with a better understanding of the financial challenges that are faced around cancer screening, treatment, and support, and to also teach you, practical strategies on how to budget for screenings, insurance available from HMOs around cancer screenings and treatments, and to also refer you to support systems and resources that are likely to aid in the support for cancer care. So now I would go into introducing our wonderful panel. We have formidable people on our panel, from our moderator to our speakers. So I will begin the introduction with our moderator, our ever beautiful Mrs. Ronke Chije. We're happy to have you with us. Thank you for choosing to do this with us today. So Mrs. Ronke is first and foremost an active member of the Dewdrop support group. She's ever ready to support us with all our activities in the Dewdrops and beyond. And she's also a premarital coach and is passionate about helping couples prepare for marriage. Personally, from the interactions I have with Mrs. Ronke, she's a very chatty person, and she doesn't just, this type of people that talk, and when they talk, you're like, oh my God, there's a lot of knowledge coming from this person. So be ready to down yourself in the knowledge from Mrs. Ronke today while we speak. Beyond her professional endeavors, Mrs. Ronke is also a cancer survivor, and she uses her personal journey to inspire others. She tries to educate them as much as possible on the importance of early detection and support, especially for those affected with the disease. So you can, give a thumbs up, a round of applause using the emoji to welcome Mrs. Ronke to our session. So moving forward, we have another formidable speaker. We have Dr. Ize Uhua Amadison, popularly known as Dr. Easy. We all call her Dr. Easy. Dr. Easy is Lakeshore's family. She's Foundation's family. We call to her every single time, Dr. Easy, we're having these. Can you support us? And she's always ready to support us. And before I go into her bio, Dr. Easy is also a member of the G-Drop support group, and she actively supports the activities of the foundation. We have a new initiative which was sponsored by Dr. Easy, which is the psychotherapy support, where we provide emotional support and mental health support for cancer patients. We would not have been able to start this initiative without the help and financial support from Dr. Easy. So Dr. Easy, thank you once again for your support in that regard. So Dr. Easy, popularly known as Money Dr. Easy, is a personal finance coach. She is big on, creating education about finances. She uses her blog and social media platforms to help young adults seek life-changing personal finance education and basically coaching them on how to, manage money, budget, and use their money as well. She is also a stage 4 cancer survivor. She battled and she won. And she has shared her experience in her book titled The Rooftop, Her Struggles and Triumphs Over Stage 4 Cancer. The book is readily available at the foundation. So if you would like to support her and read more about the challenges she went through and basically cancer patients go through, you can, reach out to us and we would make the book available. So please give a round of applause and welcome Dr. Easy to our session. All right, we're moving fast. So our next speaker is Dr. J. Odimega. I hope I was able to pronounce the name correctly. Kindly correct me if I did not. So Dr. JJ is a seasoned physician with extensive experience in health insurance and health finance. He plays a role at the Leadway Health HMO in Lagos, and he basically oversees healthcare financing and he looks into cost-effective treatment for patients. Above and beyond, he holds an MD from Premier State Medical University and multiple certifications. He brings a wealth of knowledge and multicultural perspective to his work in health finance and insurance. Kindly welcome Dr. J to the session. Welcome, Dr. J. So last but not the least, we have our own Mr. Ernest Elu. Mr. Ernest, I would start with a brief story before we go to Mr. Ernest's bio. The foundation came in contact with Mr. Ernest about a year ago when we started our Maiden Swing Against Cancer golf tournament. And Mr. Ernest works with Providence Bank, who is our primary sponsor for our annual Swing Against Cancer charity, and they have been ever supportive. Apart from financial support, they've been there to provide us with advice on how to reach people with our services. And also he's also here to share information about things the bank, Providence Bank, and probably other banking sectors have to support cancer patients. We're ever grateful for your support, Mr. Ernest. So Mr. Ernest is a banker with over 15 years of experience, spanning across investments, banking, and others. He is currently the lead strategy and business development group of Providence Bank. He is a wellness enthusiast, a leader, and he loves music. He's happily blessed with 2 children, and he is married to Dr. Lillian. So kindly welcome Mr. Ernest to the panel today. All right. So before I hand over this session to Mrs. Ronke to moderate the session, we'll just like to shake things up a bit with a little icebreaker, get everyone talking and everyone energized and in the mood. So the question goes thus: what's your favorite way to relax after a long day? It's already 4 p.m. and many of us are trying to unwind from a long day after work. So what's that one thing you do to relax after a long day? So I think I would start. You can put your comments in the chat box, or you could just raise your hand if you would like to speak. So for me, I'm actually a very boring person. So when I get back home, the first thing on my mind is food. I just want to eat. So I eat and take a bath, and I find myself on TikTok. There's a lot of things on TikTok to make me happy and laugh. So I TikTok for a while, then I read a book, then I doze off. So that's basically how I unwind every day. So I don't know if anyone else would like to share. Okay. Mrs. Ijoma says she takes a bath and she relaxes. Tolu also says she takes a bath and sleeps. Harmony, everybody likes a cool shower. That's nice. I think that's the best way to unwind. Harmony says so. Tolu watches movies. Oh my God, movies. After a long day, you're stressed. Movies work too. I think K-drama, if I'm sure, I know Tolu likes K-drama. So K-drama does the trick most of the time. So thank you everyone for sharing. Now I will hand over the session to Mrs. Ronke to moderate the panel. Welcome, Mrs. Ronke.
Hey, I'm clapping for myself. Yeah, good evening, everybody. Welcome to a beautiful time. So I'd like for everyone to take a deep breath and just be conscious about it. Take a deep breath, and then we'll start. Are you all ready? Okay, so Dr. Easy, how are you doing?
I am very fine, Ronke. Thank you. It's really, really nice to not just hear from you, but see your face. It's been a while. But yeah, thankful and happy to be here. And hope you are doing, I mean, you're shining as always. So yeah, happy to
Thank
be
you
here.
so much. Yeah, well, everyone knows that I am a cancer survivor, and during my treatment, I met with Dr. Easy, who gave me courage to fight the battle. In fact, there were days that were really dark. And then you see me sending out messages any time of the day, like, Dr. Eze, how do I go past this? What did you do? This is how I'm feeling. And she's ever willing to answer me, to provide solution, to call in and check in on me. So, Dr. Eze, it's good to have you here today. And I know we are going to have a very good time. Hope you're ready for us.
Very ready. And thank you. Thank you for all the kind words. I mean, I tried to be as supportive. I didn't always have answers clearly, but I'm glad that at least what I was able to share was helpful. So
Yeah, thank you. So today I'd like for you to share your personal experience with cancer and finance. How was it for you?
oh, okay. So just to give a bit about my story for people who know, I'm a medical doctor. I had started a residency program in University of Benin Teaching Hospital. And I was like towards the end of my first year when I noticed blood in my stool, and that just led me down a rabbit hole. And yeah, landed at the diagnosis of rectal cancer. It's turned out to be stage 4 cancer because it has spread to like my liver, places. So yes, my life kind of changed very drastically in a short space of time. And I'm going to say something that is very obvious, which is that cancer care is not cheap. It definitely is not. And there's a lot goes into it, even just beyond the treatment, beyond the actual maybe chemotherapy or radiotherapy or whatever the treatment is. It's in addition to everything, it's all the tests the consistent tests that you need to do. It's the being in and out of the hospital. It's everything catering to every way that your life has to change. Things that you have to start eating, stop eating, just all like it is very, very intense. All over the world, there's no place that you can be like, okay, this place is cheap. Obviously, relatively, some places are better than others. So yeah, tons and tons and tons was spent. Now, I would say I'm super thankful and grateful. I mean, to God and to the supportive family who really, thanks to, I would say, a good deal of financial foresight and stability, like over the years, we were able to have resources to cater to like all that my treatment required. No one prays for bad things. Obviously, nobody is thinking, oh, I'm going to save so amount of money. So if I get diagnosed with cancer 10 years from now, I'll have what to save. Nobody like plans that much. But it's always good to have as much of a cushion as possible. And I think that's for me is a big kind of inspiration and push for why I really talk about all the financial education stuff we do, coach people. It's really about getting to that place of good like, financial security and all, because you just do not know what could happen. Life happens all the time, right? So yeah, I started like after like my diagnosis, my treatments actually started in the US at the MD Anderson Cancer Center in Houston. And then when I came back to Nigeria, that's when I started attending Lakeshore, and I kind of had been shuttling between that, went to India as well, started new treatment. So having to deal with, I mean, the chemotherapy, the radiotherapy, I eventually, like the surgery, I eventually had immunotherapy as well. All of those things are not cheap. Like it really went into the hundreds, thousands of US dollars, like literally. So yes, it was not something, there was no way in hell I was going to be able to like fund that myself. So I'm really thankful that there was that like vision, which I know is not like everyone's story, but that happened to be mine. So I mean, yes, out of what I had been able to kind of like save from my own salaries and all, that had to help here and there, but it was really just a drop in a mighty ocean. So I'm really thankful. I mean, for that, it wasn't easy. It definitely wasn't easy, even with that. Finances is definitely a big, can be a big determinant when it comes to outcomes for these kind of situations. And I think what is really, or one thing that is really say tricky and unfortunate when it comes to like the disease called cancer is unlike certain illnesses where it's pretty straightforward that if you get so and so medication, you get better. Like this is the natural progression. This is just how you're going to recover, and this is where you're going to land. Cancer is a very wild and tricky disease, such that there's still uncertainty in the outcomes. There was literally no guarantee that getting those treatments, which are really good treatments I was getting, was going to make me go into remission. I was going to be cancer free. That was not something that like was a guarantee. And then we see there are so many cases where people who may have the same kind of cancer. I mean, they may be around the same age, same race, just as human beings may seem very similar, but then they have the like treatments and one has a good outcome and one has a bad outcome. It's just, there's nothing certain. So another tricky thing when it comes to finances, because yeah, we're really focusing on finances, right? Is that sometimes people are unsure as to what to do and how much funds or where to even put those funds to be able to get a good outcome, or at least give them the best chance of having a good outcome. I'm grateful that mine worked out because it could have easily not. I got diagnosed in December of 2020, 2016 at 27 years old, and 21 months later, that's by September 2018, that was when I was declared like to be in remission because did not pick up any cancer cells. And thankfully, so far, it's been 5+ years, almost 6 now down the road, I'm still in remission. So it's a tricky one, really. Cancercare is the weight of Cancercare. Obviously, it's not just the survivor who has to go through this. It's the family, right? Because my family definitely went through it with me. My friends did it with me. Everyone who is a caregiver, support system, or member of a support system, and your healthcare team, like they're in it with you, right? And trying to chip in. I'm really glad someone in the insurance space is here to like to talk to us about that, because I mean, as much as I know, I don't know the nitty-gritties when it comes to like the Nigerian side of things. But insurance, we know that insurance can be helpful, can help cover some costs, but it typically would not cover the entire cost of cancer care because it's just a lot. It's a huge burden. So yeah, that's pretty much like my story and I guess my thoughts around that. So back to you.
Yeah, thank you so much, Dr. Isaac. Like, there's something you said, people don't just save money and expect themselves to fall sick. They don't. And I can imagine you mentioned Eastern, you mentioned India, you mentioned Nigeria. That's a whole lot. Well, mine did not go that way. And I'm happy you also mentioned the fact that you could have same cancer, same race, same thing. It's not a guarantee that because this is working for this person, this is going to work for this person. So now that we know your story and how far you've gone, I'd like for you to also try to, what can those people who probably just discovered that I have cancer, what can they do? How can they strategically save money, or how can they plan for treatment? Because I think there's priority based of treatment from radiotherapy, chemotherapy, surgeries, and all of that. What's your advice to those who probably just got diagnosed? What do you tell them to do, and how do they spend their funds regarding this?
Yeah, thank you for the question. And from here, I love how you mentioned the word priority, right? It's a tough thing. It's a tough diagnosis to accept. I think it's one that it's not going to be something you fully accept in a day. But coming to that realization that, yes, I mean, life as you know it has changed, and it's now about how to move forward, right? So prioritization is key, like carefully prioritizing what's going to like take precedence in your life now, right? And like to believe for everybody, hate it or love it, health is the priority. I mean, that's why they say it doesn't matter how much money you have or just all the other good things that happen in your life. Like once your health is compromised, that's literally all that matters, right? So in this situation, yeah, health is number one, right? So that has to be priority. You have to now plan out, okay, what's your care going to look like? I mean, and like subsequent screenings and all of that. So it's important, and this is something, I mean, hey, if you have like a significant other family, this is something that you could like do alongside, because everybody's life will have to be adjusted, right? So it needs to do that. I mean, taking stock, taking inventory of what it is that you have in terms of like financial capability, it could be money in the bank, it could be assets, all of that. You just have to know where you are, like what can you handle financially, is key. Still with the prioritizing, right? Yes, we said health first. So also being able to stick to like essentials of your care, right? Things that are going to help you live like in this moment. This is not the time where, and I'm not saying this to be very strict, but in terms of like entertainment, this is not the time to prioritize that, like your needs first, the one. So when it comes to things like this, yes, there's the medication, the obvious, maybe hospital visits and all, but then the right kind of nutrition, being able to get proper rest, like all of that takes priority over maybe like cinemas and stuff. And I'm saying it's not like it's not like because you have this diagnosis, all manner of fun in your life must be cut off. No, that's definitely not, because you need those things, even just for your sanity. Going through this process, you need them. But yeah, it's just finding that balance. It's sometimes tricky, but finding that balance is key. Just sacrifice what you need to live, sacrifice what you need to. So I'll say that. And this is a bit tricky one, because this is not something that many people, they don't want to feel, first of all, they want their business to be out there, and then they don't want to feel like a burden. And I'm going to like use my personal story. One of the things, or one of like the strong emotions I felt during my journey was guilt. Guilt that, oh, like resources that could have gone to XYZ that people were planning to use for this and that was being channeled to just like keep me alive, right? Or which I may not even still be alive at the end of the day. There was a lot of that whole guilt, like I was draining resources, I was putting my family through this, causing people's lives to change, right? So when it comes to like the finances, it's this one, it's easy to feel, I would even say maybe kind of normal for us to feel like guilty, but it's important also to shed that guilt, right? Because the people who care about you, love you, to help you. So as much as your life is changing, other people, and not just your immediate family, it could be other people who want to support, people at work, it could be people from like maybe church, mosque, like anything like that. Just allow people help you, monetary, and then otherwise, it must not just come as money. It could be, there are other things that you could do to be like of support, or they bring like food items, or maybe they're even like showing you to maybe have a spa day, or just things like that. Like allow people help you. It's tricky, but it's important. Obviously there's capitalizing on any kind of like assistance and help you can get, e.g., like your insurance, if you have your insurance, and there's any kind of, it may not cover the entire care, but it could be a help. So I would strongly advise that that is looked into, capitalize on your insurance, and I'm sure Dr. JJ hopefully will be able to give more insights into that. I would say having money conversations is important, because some of the time we're just kind of racking our brain, the whole, how will this get paid for, how we do this. We just kind of hold all that in and internalize and everything, our struggles, but it's important to unburden. It doesn't necessarily mean that the person you're talking to must have the answers for you or just have the expert insights, but being able to do that, like there's just something about through issues, you can gain some clarity, some insights, talk to somebody who doesn't need to be like an educator or coach like me, but hey, it could be someone like who is like maybe knowledgeable in family, it could be a friend, somebody who give insights, because hey, you don't know what you don't know. It could be that just that conversation is going to provide some really good like help or insights into where to get help. And if nothing, at least just venting and freeing your mind is helpful. So that even helps you like emotionally. So there's that. And then last but not least, I would also say, kind of find ways, especially creative ways to make money. Now, this is something that it has to be done as much as your body would allow. Cancer, dealing with cancer, the illness itself is not, it's not easy. The treatment itself can really weigh down the body. I know how, quote unquote, useless I used to feel after chemo. It wasn't something that I could start like kind of like work like the regular person. But trying to find creative ways, and this goes to not just you now, maybe like your immediate family and people who want to support. It could be such a thing as, hey, by the time you looked at your priorities, looked at your house, like just things of, okay, what can help me fight this illness, be in the best state of health. You could have something that's in the house that really is not, you don't maximize its use, so you don't use at all, like something that can be sold, traded in for money. So you're just maybe decluttering your house and selling something or leasing something out, like just things like that, right? Are things that you can begin to think about. It all comes down to like prioritizing and kind of being a bit creative. So yeah, those will be my tips or suggestions as to how people can kind of navigate this finance. And it's an ongoing thing. Don't expect to be like perfect off the bat, like nobody is. We just kind of have to adjust as we go. And it's definitely not cheap. It's not cheap. Capitalize on anything you can. People set up like GoFundMe pages to help people's treatment and all those things. They help. They actually do help. So yeah.
Thank you so much, Dr. Ize. And something you just keep saying, which of course I can totally resonate with, it's not cheap. It's not cheap. And even your location actually has impact on the cost as well. So I remember I'd have to travel from Port Harcourt all the way to Lagos to do my treatments. And then you're thinking of accommodation, you're thinking of feeding, you're thinking of your caregiver as well. So there's a whole lot that comes in when it comes to cancer. It's not just the treatment that consumes the funds. Other aspects actually consume the funds that you will not even be able to recall at the end of the day. But then there are just these little things dragging you left, right, and center. You spend money on this, you do money. So location is actually very important when it comes to cancer care. And that's the more reason I'm even so happy that Lakeshore is currently in Port Harcourt. So it's a good one. I'm really happy. Congratulations to Lakeshore for opening a center in Port Harcourt. At least that would save the flight cost, actually. That would save a whole lot for people down here. And if I cannot tell you how much having this in this town has actually cut off. There were days when I saw my hotel bills, and like you said, you feel very guilty. I felt so guilty, like when I look at it, and then when I look at it, I start asking myself, God, what's going on? Where do we go from here? So as much as we can, and I'm happy for the fact that he said that let's capitalize on as much as we can. For me, if you're going through this whole cancer journey, look for strong support system. Your support system will actually play a very big role on your survival. Because if you don't have a strong support system, your mental health, what the cancer, in fact, what the treatment would even do to you would just damage you. So there's a whole lot that comes to play when we're talking about cancer. And I'm happy you said insurance. People need to start taking insurance very seriously, especially in this part of the world. And I'm happy that we have Dr. J here today. Hello, Dr. J. I'd like to hear from you. Hello.
Hello, Ronke. Hello, everyone. How you all doing?
Nice to meet you. Welcome.
Thank you very much.
Yeah. So, but before we start asking Dr. J, let's just try to do a survey to see what's going on when it comes to insurance. So if you know you have health insurance at the moment, can you just indicate with an emoji? You can say yes, you can say no. If you know you have health insurance, can you just indicate, let's see, let's just get a number. I'll check the chats. Let's just see. Okay. I'm happy to see. Thank God. I'm happy to see. Yes, yes, yes. I'm happy. That's a plus. Okay. I'm happy. This is good news. This is good news from this part of the world to see this number of years actually. Thank you so much. Dr. J, welcome.
Thank you very much, Ronke.
Yeah, so you heard Dr. Easy, how she said we should capitalize on everything. We spoke about priority, and then something she just keeps saying is cancer treatment is not cheap. It's not
Oh.
cheap at all. So please, can you just give us a very beautiful talk about insurance? What do we need to know about insurance when it comes to cancer care or when it comes to our health in general?
Dr. Itumwa for surviving cancer. So it's not easy to survive cancer. And seriously, when the doctor was talking about her survival, telling her story, I felt touched because if you could actually have cancer and you can actually have money to actually treat this particular disease, but you might be confused, you don't know where to go. Might be confused, you don't know how to start because there are so many issues surrounding cancer treatment and even financing. So let's talk about the general public. Let's talk about Nigeria as a whole. It's just 3% of Nigeria insurance, and 3% because insurance for them. So people have health insurance is you're sure about prevention, you're sure about treatment, and you're also sure about follow-up. Most times people get confused about what kind of health insurance am I supposed to buy? What kind of health insurance am I supposed to be advised on? But there are certain factors you look at before you actually take a health insurance. The most important one is, first of all, where are you? Where are you? Because in this part of the world, the kind of health insurance coverage is different from any other part of the world. Then, second thing you have to look at because of this part of the world, diseases who are endemic to this part of the world. Then the age of the person, the sex of the person, and also the occupation of the person. Because most most health plans are designed according to your profession. Most health insurance are actually designed according to your sex. But when it comes to cancer, we take a holistic approach because for health insurance is for cancer patients or for those who might want to their aim is to prevent cancer is structured according to your exact needs. There are also plans who are designed for patients. These particular plans are center specific. For instance, cancer centers, yeah, there are plans who are designed to actually suit those particular centers. So patients who are actually harnessing health can be able to have full coverage. The problem that we've been having with health insurance is a lot of people don't actually believe in health insurance. And that's why the health insurance coverage in our country is so low, just 3% out of the whole population. We can actually do more. We've barely harnessed the surface. And the reason why we've not actually gotten deep into health insurance is because a lot of people don't actually believe that things can happen to them. In this part of the world, we have the over my dead body syndrome because you actually invest in what you believe in. If you don't believe that cancer can actually be treated in the clinic or in the hospitals, you will never invest in it. We also have the problem of we have the ethno-religious problems, whereby when people are sick or maybe when they are diagnosed of cancers, they first of all run to religious homes. So a lot of them, when time must have been wasted and they come back, it becomes a situation whereby that can never be reversed. So this problem of a religious crisis, whereby even some areas we can't actually find professionals who can actually, like, remember, Ronke, you were talking about how you had to travel all the way from Port Harcourt to Lagos to be able to harness your own treatment. We also have a problem of, for instance, let me give an instance. There's a scan called PET scan. Those who have actually gone through cancer treatment will tell you about it. We only have one center in the whole of West Africa, whereby you can actually do the PET scan. And if for any reason the machine breaks down, if for any reason there's a repair, do you know what happens? There'll be backlog who are supposed to go for that kind of test. So we have manpower issue. We all know about the brain drain, how people are living how doctors are living in their droves. That also affects the amount of people they are supposed to cater for. I can tell you that some states don't even have up to 10 oncologists. So Lagos State is lucky. It's widespread. We have centers, specialized centers like Lakeshore and all. So imagine those states that don't have those kind of specialized centers. What happens? People will have to migrate to Lagos to be able to harness care. So when it comes to cancer treatment, the most important thing is not just money, because you can have the money and you're confused, and that's where health insurance companies come in, because they know where you need to get certain level of care. They know where, even if you need a second opinion, they're at your beck and call for a second opinion. Even if if you need guidance, they are also at your beck and call, and also follow up. Because listening to you and Dr. Izua, there are two things you guys kept on talking about. One is the cost of cancer treatment. We all know it's now a song in our ears. Cancer is not cheap. In fact, healthcare as a whole, healthcare is a business. Whenever you find healthcare cheap, just know that somebody must have subsidized heavily for it. Do you understand? So now, looking deeply, you find out that one is cost. How do people actually run around to pay for cancer treatments at all? Because cancer doesn't want anybody. It can show up anytime. Most times it even shows up when you don't have anything. But if you have health insurance, at least you're halfway there. Most of the tests, the screenings are covered, even the treatment up to a certain level, depending on your kind of plan. Then secondly, there's something Dr. Ihuzowa mentioned. She talked about your support system. And Roque, you also mentioned your support system, because one, in the treatment of cancer, this is new to the patient. Everything has changed, their lifestyle has changed, a lot of things they have to drop. It's confusing, it's irritating. And the only way they can actually survive that process is if they have a good support system. And those working in lecture can tell you that at some point your support system, they get tired, because it's not actually easy taking care of somebody. Do you understand? And a lot of HMOs like Leadway, that's why we have a follow-up system whereby we follow the patient from the day the patient is diagnosed to the day the patient is actually discharged. Then we'll continue the follow-up care, because for you to actually survive cancer, there are a lot of things that play a role. Not just the treatment itself, because we've seen cases whereby you're having the right treatment, the right drugs, but a different outcome. Most times that gap is actually closed by your support system, because you yourself, you have to actually believe in what is being done for you. You have to actually believe in the treatment being given to you for it to actually be very, very effective. And it's easier for you to do that when you have a support system. People who understand what you're going through, or they have place to be there for you regardless of what's going on. So for health in general, not just about cancer, for health in general, your health insurance is very, very important, because we've seen a lot of people who just discovered something they never thought they could ever discover. And I'm like, oh, I just got diagnosed of cancer. But you look healthy and all. It has no it doesn't inform anybody. Cancer does not inform anybody. Cancer does not take any permission. It just shows up. And when it shows up, you better be ready. And by being ready, I mean having one a financing plan, either through your HMO or personal, maybe communal contribution, NGO, however. Then secondly, your support system. So if you have these two factors, you're almost halfway there to actually succeeding in treating cancer.
Hello?
Yeah, I can hear you.
Okay. Thank you, Dr. J.
Yeah.
Thank you so much. You said a lot, and it's actually shocking to know that just 3% of the country actually has insurance. That's not a good number. It means more awareness needs to be done. And there is a lot of stereotype when it comes to insurance. Like Dr. J said, people are being religious about this whole thing, saying, God forbid, it will never happen to me. I don't think that's a good one. I mean, nobody wakes up and say, cancer, come to me. Nobody wakes up and decide, okay, this is how I'm going to end up. This is what will happen. But there's always a beauty in being proactive, planning your life, not being, life itself can be difficult. As much as you can plan your life, I would actually advise people to plan their life. One way to plan is having health insurance. Like Dr. J said, very key. And when it comes to cancer, I totally agree with you when you mention it's not just hearing about I have cancer. It takes a lot. Different doctors, different specialists, different hospitals. You actually go to so many places just to get yourself cured. I mean, there were lots and lots of hospitals I had to visit, from Dr. A to Dr. B. This one say, okay, I'm done. This one will say, continue with this. And then the next person say, okay, you're to do follow-up here, do all of that. And thanks be to God that I actually have insurance that helps myself and my family. So we did not really feel the heat when it comes to finance, thanks to insurance. And my advice to anyone here today is please try to get your health insurance, and also ask your family, your friends, ask them, do they have health insurance? Those that are working around you, your colleagues, try to find out for them. Dr. J, are you still here with us?
Oh, yes, I'm here.
Okay, so for future purpose, I'd like to know, since it's just 3%, it means we have people here today that they do not understand where to start from. So my question now is, okay, let's go back and say this. For those who are here today and those who we are going to broadcast this whole thing to, where do we start from when it comes to health insurance? Let's just even leave cancer by the side. Where do we start from when it comes to health insurance?
Okay. The most important thing is for you to actually need health insurance. That means you care about your life. And this is the first step. You have to understand, for you to actually ask about health insurance, that's because you're interested. And I know, speaking on this forum, this is the first time a lot of people are actually getting first-hand information about health insurance. Most times you wonder, okay, how do I go about it? What do I do about it? What kind of health insurance do I need? That's where we come in, because we are going to be your insurer. We advise you based on your age, your sex, your location, your past medical history, or even your current medical history. So are there plans tailored according to your need? Are you undergoing cancer treatment, but you want a health insurance to come in? There's a plan for you. Is it the screening part? You want to screen for different kinds of cancer? There's a health insurance plan for you. And even in all our health insurance plans, every one of them, you're entitled to annual medical screening. But should I tell you the funny thing about it? A lot of people don't actually show up for these annual health screenings, because that is where that is mostly the first time where cancer actually diagnosed. Most times, a lot of people don't even know until it's far too late, and the prognosis becomes bad. But if, for instance, you have a health insurance, you're entitled to annual medical screening. That's the first stage. if it's discovered early, because if you check prognosis of cancer and even duration of cancer, it depends on when it was actually discovered. If it's discovered very early, you might not even have to do more than so many cycles. Most times, surgery does the job. But if it's discovered late, that's when you have to do advanced investigations, move from one specialist to the other, because a general surgeon has to be involved, an oncologist has to be involved, and all. So if you come to us, we'll design a health insurance plan according to your needs. Those who have cancer, the health insurance plan for them is designed according to cancer treatment, depending on how you want it tailored down. But one thing is because health insurance in Nigeria really has a very, very poor awareness. Because a lot of people, the reason why they have health insurance is because they work in a company.
True.
Take away, yeah, and now see now a lot of people are. Remember, we said it was 3% using health insurance, and see the way companies are leaving the country. That means a lot of people are no longer employed. That means they will lose their health insurance coverage. So that number, that 3% might actually reduce. But there are health insurance plans for individuals, not just companies, individuals, you as a person, or you and your wife, you and your kids. There's a health insurance plan that covers a whole family. And it's actually affordable depending on the plans you take. And even the lowest plan, you are entitled to annual health screening. So the first thing for anybody to do is reach out to a health insurance company, maybe like Midway, and Midway will design, the underwriting team will design a health insurance plan that tailors directly to your need. That is the first step. Because with health insurance, it's easier. Let's say, for instance, you have no health. I want to take the basic thing people love doing. Let's say, for instance, you have a health insurance plan. You might stay 3 months. I'm like, I've not actually used, or I've not actually harnessed my health insurance. Let me just go for teeth whitening. That's because you have health insurance. Oh, I have abdominal pain. Let me just go see a doctor because you know it was already covered. But if you don't have health insurance, you're paying out of pocket. You might want to wait it over and see if the abdominal pain might resolve by itself. So you don't tend to spend that money. And let me tell you, the cheapest, the most affordable, or maybe the lowest health plan, it's something that a lot of people actually can spend in a day. So
Wow.
because it's easier, because we have to make it that way for people to be able to access health insurance, because health is not cheap. But with HMO and with health insurance companies, we'll be able to see a way whereby we can actually make it affordable for everyone. Because we're in a country whereby minimum wage, I think, is about 30,000.
Yeah.
So imagine having 30,000 and you are still asked to bring out something for health insurance for a month. So that's why we had to actually break down those plans so that even the common man can be able to afford it. But the problem is, do you actually believe in health insurance? Because if you believe in it, you won't see a problem with investing in it because it's your health. Like I always tell people, when you receive, maybe when you're making plans for the year, as you're making plans for feeding, the next plan should be your health.
Sure.
That should be the next thing on your mind. And because in this part of the world, health insurance is not yet compulsory. It's still a big problem because most times emergencies happen and the delay in attending to you because you don't have health coverage. So it's not just about cancer, it's about everything that relates to that relates to health. Nobody knows when an emergency will happen. Nobody knows when they are going to be diagnosed with something or cancer. And even those who feel they are living right, they're living a healthy life, a lot of them still get diagnosed of cancer because there's no particular formula for it. So that's why you have to be prepared. I know when something's happening in my mind, I say as a person, I say over my dead body, it might not happen to me, but I still have my health insurance. So be prepared, even if it doesn't come, but be prepared. It might not be cancer, it might be any other illness, but always be prepared. And how you prepare yourself? Have a health insurance. And how do you have a health insurance? Reach out to a health insurance company. Let them draw out a plan for you. It might not solve the problem completely, but you'll be there 80%.
Thank you so much. Thank you. I'm so happy to hear this. It means every one of us, we need to start from somewhere. And I'm happy with the fact that you said that it's even easier for people to get diagnosed early, so they don't even have to suffer the bigger one.
Yeah.
Very true to that. And something you kept on mentioning, which I'm so happy that the insurance company they are doing, is you have a yearly routine medical checkup. That's a big deal because sometimes this, like you said, these things don't show in our body. We feel good most times, but meanwhile, there's something really big happening in our body. So I'm so happy to hear that the insurance actually does all of that. So for every one of us here today, my advice to you is your loved ones are very important to you. Your friends are very important to you. Try to have insurance awareness. Inform people, ask them, if you fall sick today, if you have a stomach ache and you need a surgery, will you be able to get it done immediately? So please encourage your friends. We know we don't pray for bad things, but there's nothing wrong with ever being prepared because life itself doesn't even have a go straight manual. Everyone is just living life as it comes and trying to navigate, trying to survive. And in survival, you need to take everything you have. So insurance is a big deal. And I would say, please, if you're here today and you do not have insurance, do not let Dr. J go away without asking him very big questions. If you have questions, please just leave them in the comment section. And I can see someone actually asked a question, Dr. J. The person asked, do we have insurance plans for individuals who have cancer? I think Dr. J has spoken a bit about that because he said, okay, great. Good.
We do actually. We have insurance plans for those who have been diagnosed with cancer. We have insurance plans for those who are currently being treated for cancer. You know, so we have insurance plans for those who don't even have cancer. So you understand? So there's insurance plan that tailored to any need.
I'm happy to hear that. And someone would also like to know what's the least amount one can start the insurance with for advanced stage of cancer. What's the least amount, do you think?
Okay, well,
you could give a range.
Well, it differs with cancers because different cancers have different treatments and different cancers require different drugs, and all these drugs are all imported. So that's why for every plan, you understand, your past medical history, your current medical history, it will be used to design one that is tailored to you.
Oh, great. Oh, that's that's why Dr. Easy would not stop saying that cancer is expensive. It's an expensive disease, actually. Very expensive. In fact, it's very bitter to see people who have the reoccurrence. I mean, you just survived one and then it's coming back again. It takes a whole lot to survive. And I pray that we'll continue to survive and have ourselves around. So for those of us who are here, I pray you don't need to have any cancer diagnosis, but get yourself checked. Do screening. Endeavor to do simple breast examinations that you can do. So it doesn't get so bad and then you'll be thinking of imported drugs for you, because Dr. J just said that these drugs are imported and they are tailored to the type of cancer, which I totally agree. I mean, when I was doing my own chemotherapy, my drugs actually run for, I think, about 48, 72 hours compared to others who I see, they just sit on the chair in maybe from morning to like evening, they are done. But mine actually runs for days, for long hours, actually. So I agree with you. And so thank you so much, Dr. J. So Please, Mr. Ernest, are you here with us? Let's go over to the bank and see what they have for us. Mr. Ernest, we cannot wait to have you, please. Are you here with us? In case you're trying to talk, you are okay. Thank
Yes,
you. You've
yeah.
actually unmuted.
Yeah, sorry about that. Hi, everyone.
Thank you. Good evening. Nice
Good
to meet
evening.
you.
Same here, same here. Nice to meet you.
I hope you've
Um,
enjoyed our session about experience, insurance, and then now we're coming over to the banks. Can you just tell everyone what the banks have to offer when it comes to cancer care? Where do we start as a customer? Where do we start? How do we start?
okay. Nice to meet everyone, and it's been an interesting discourse. Interesting, inspiring, and very enlightening. I mean, hearing from everyone, Dr. Izzy, Dr. JJ, and of course yourself, Runke. Um, from my own point of view, I mean, like you rightly pointed out, I'm talking from the angle of a bank. So I can basically relate with everything you have said, or rather, what everyone has said with respect to financing, especially for cancer patients and the likes. And starting from the very beginning, where you say cancer care could be expensive and treatment and the likes. But in answering your question directly, I mean, which is more or less the elephant in the room, talking about, okay, do we have um eh, specific packages or products directed or rather curated for cancer patients? The answer is no. And I'll explain why and how we go around it. Okay, so first and foremost, I acknowledge that cancer is, as it were, is one of the ailments you look at. I mean, the major ailments you want to um, look at as and as a very critical aspect of. Sorry about that. Sorry about that. The call came in and I
Thank you.
just had to. Okay, yeah. So, while it is, I mean, a very major topic for healthcare discussion, it's not the only one, and we have quite a number of others that we refer to as major health discussion topics. Um, we wouldn't like to segment or, I mean, just keep aside a particular ailment and say, okay, yes, there's a particular product for cancer treatment or mediation or whatever. We'd rather look at it from a global point of view where we speak about wellness, we speak about treatment about healthcare issues. So whilst there isn't any in particular a financing need or a financing solution for cancer, we have financing solutions with respect to healthcare and wellness. And I hope that, in a way answers that particular question. I'll go on to say that remember, we're also a financial institution, which and our basic function is financial intermediation. And so, speaking to cancer in itself, what we have decided to do as a bank, and that is why, that is why we have we have the partnership and collaboration we have with Foundation for Cancer. What we as a bank have decided to do is look, we might not be able to curate programs or products and services that speak exactly to cancer, but what we can do is partner, collaborate with institutions that offer specific care to these kind of ailments. And that is what, it is a strategy for us in speaking to some of these particular ailments, as it were. And that is why we have decided to collaborate with the likes of Foundation for Cancer Care in offering specified or specific services and products to cancer care. to cancer patients. So, I mean, in a nutshell, that is how we see our own contribution to alleviating or rather addressing the cancer question or rather questions around cancer care, as the case may be. I don't know if that answers your question.
Yeah, very well. And well, you very much pointed out that no, there's no specific fund, should I say. There's no specific is it fund, I'll call it, for cancer care. But when it comes to partnership, you guys are able to partner with others to see how you can be of help. So do you encourage cancer patients to get loans? Do you provide loans for cancer patients? What do you give to them actually when they come, when it comes to health? What do you offer them?
Okay, so it's still a very dicey question. Now, um, and I would say this with every bit of sincerity and forthrightness as possible. In taking loans, we all know that quite a number of things are considered. As a bank, what we try to do is be flexible as possible. So it's not your plain vanilla processes where you just say you must bring your father's, certificate, your mother's, and all these kind of things. There are what you call, there are what you call considerations with respect to obtaining a loan. But, I want to start by throwing back this question, which I feel is very, very critical. Should individuals actually take loans to access healthcare? I'm just looking at it from one angle. And if you're being sincere with me, I'd rather we don't look for loans. I'd rather we look at grants. I'd rather we look at institutions that provide for these situations, partner with them as a way of contributing to that situation. Personally, I'm just looking at it because in talking about loans, and we're being factual here, some of the things that are being considered are the age and well-being of the individual or the institution, as the case may be. Now, as a bank, you're in the business of making profits. Nobody goes into a business with the intention of, losing out eventually. If there is no guarantee that this business is going to be operational in the next 2, 3 years, there are chances that you might not want to give out your money because these monies are actually for depositors. You don't want to take the money from depositors and give to businesses you believe will not be in existence 2 to 3 years to come. I'm just painting a picture so that we understand how it works in terms of loans, in terms of facilities, in terms of credit for banks. So the health, and that is why sometimes you even have to go and there has to be some form of health insurance certification when you're taking personal loans. I don't know if you understand what I'm saying. That is why banks might not be big at creating loan products for medical situations per se. I'm speaking for Providence Bank now. We'd rather, give grants, we'd rather partner with institutions, hospitals, or insurance companies that will provide wellness that will provide the form of health and wellness that these will need rather than giving loans. I don't know. It doesn't fit well financially, to say there is a loan product for people who are having challenges. Yes, on a personal note, you could take a loan but these will still be put, these will still be put side by side against different matrices, against different things. Okay, how well is this person doing? We want to be sure that this person will still be very much around to be able to ensure that this loan is performing eventually. So I on the backdrop of that, I want you to understand how it works so that we don't get ourselves we don't get overly sentimental or emotional. about these kind of things. Having said that, we'd rather look at a situation where we will give to institutions that proffer this kind of services to customers, such that eventually everybody has a feel of wellness per se.
Okay, thank you. You mentioned institutions. Do you care to share maybe one or two? I know you said insurance companies where you guys would rather partner with. Where should people actually look out for? Are you advising us that we should go ahead to just insurance and don't bother with the bank, or where do we go?
Okay, well, I mean, first and foremost, I mentioned an institution just like Foundation for Cancercare. I mean, they're doing
Cancercare,
a
yes.
lot in terms of awareness. They're even doing a lot in terms of providing some form of support, some form of check treatment and the likes. I mean, for the past 2 years, we've followed, their activities, and we're very happy with what they're doing. It's in line with our course as a bank. So we are proud to say that we're partnering with them so that they can offer these services to their clients. So such institutions such as this, some hospitals, in fact, in our wellness initiative, we partnered with quite a number of hospitals that provide specific, healthcare services to customers. We're not a hospital. So what the best we can do is partner with these institutions like hospitals, insurance companies, organizations like Foundation for Cancercare, such that these services can be brought to the forefront of this custom. Yeah, and so that goes without saying.
Thank you so much. And I'm happy you were very straightforward with us. You just told us how the loan system or the bank system actually works. Well, it's very logical if you think about it, the well-being. I could take a loan and probably be dead the next day. Who's going to pay? So I can totally understand that your partnership. Well, it's also good to learn that you guys are into partnership with other institutions. I'm very happy to hear that. So for those listening to the Foundation for Cancercare, they're doing a whole lot. And also insurance that are doing a whole lot. Let's take advantage of these places, these institutions, insurance, the foundation care. Contact them, talk to them, and see how they can be of help to you. Thank you so much for speaking.
Can I quickly say
Very
something?
grateful.
Can I say something
Yes,
very
please.
quickly? So there are a number of things we're very big on, and it will do me. I'll be doing a lot of disservice if I do not mention this. I mean, one thing that we're very particular about is wellness. I mean, healthcare. That is what informs our drive towards such partnerships like I've mentioned earlier on. We're always thinking, without going out of regulation or out of what we're supposed to do. We're always thinking of the next way, the best way to always help our customers, to always add value to our customers. And that is why you see us push for such partnerships and collaborations with I think someone just asked the question. That should be for Amanda.
Yeah.
But I think the answer is yes. Just so that I say that quickly. They just opened one in Port Harcourt. Amanda, I'm right? Yeah, yeah. Okay, so for me, it's about value. It's about how best you can grow your wealth. It's about how best you can live your life, to fulfillment with as much value as much as possible. So that is where we come in with respect to financial inclusion, financial literacy, and even growing wealth. And that is what we're all about as a bank. So irrespective of your food, irrespective of what you do. I think that one thing that should always be at the back of your mind is where you can get the most value for your money. And if you ask me in terms of value, I think we offer value not just in monetary terms, but as well in intrinsic in in terms of what we do for and with our collaborators and partners, to enhancing the life of our customers. So that's where we come in. That's where we're big on. And that's why I think Providus Bank is your best bet anytime. Thank you.
Yeah, just so I can quickly ask you, how about emergency funds? What do you advise? Do you advise people on emergency funds?
When you say emergency funds, you need to be more explicit, please. What do you mean by emergency funds?
Okay, so maybe a young person who is here today is trying to works in a good place, gets good money, opens a savings account, and that's just all they have. Do you advise them to have individual accounts for specific things just so they don't have bulk of their money in their current or savings accounts? And at the end of the day, they end up spending all of them.
Oh, sure. Okay. Thanks for this question. I believe that savings is key. What's more is, of course, investment, but the most important is being able to find a partner that will grow your wealth with you. So my advice is always, I mean, put your money where you get returns, where you get value. For a lot of
Okay.
people, the question is always, what should I do? Where should I put this money? Um, but I mean, simply, even though you don't have anything to do, even though you don't have any idea as to where to keep your money, put your money in Providus Bank, because we offer savings, we offer interest rates on even current account. That's one way that we add value to our customers. So just by keeping your money in your current account, you can be given, interest rates based on your monthly average balance. And I think that is one way to add value to our customers. So yes, savings is very key, which, like you rightly pointed out, will be useful for emergency funds. But talking about even everyday spending, these little interest rates that we give could assist in your everyday spending and eventually add value, bring about value to your life. So yes, savings very key, investments very key, but most importantly, growing with a financial partner that thinks about you, and that's where we stand. Thank you.
Thank you so much. Amanda, over to you. Thank you so much.
Okay, thank you so much, Mrs. Wonke, and thank you to our wonderful speakers for, showering us with so much knowledge. I, for one, learned a lot because especially from the session from personal sharing and the session on HMOs, as well as from the banks. We would like to stress that each of the speakers has contributed one way or the other to the activities of the Foundation for Cancercare, from, providing this knowledge at this webinar to providing financial support. As Mr. Ernest rightly mentioned, Providus Bank is big on wellness. We have, been part of their wellness walks in the past. They actively, support our activities. And with their support, we have been able to sponsor radiotherapy treatment to patients, to screen people in the community for breast cancer, prostate cancer, and cervical cancer. And Leadway, as well, has in the past also contributed to the initiatives of the foundation. So we would like to really thank all our speakers for, this insightful session. So before we wrap this up, we have a question. I have a question in the chat box asking if Foundation for Cancercare is in Port Harcourt. Lakeshore Cancer Center just opened a center at Port Harcourt on 11 Nembe Road at Port Harcourt. Permit me if I did not get the pronunciation.
Let me help you with that. Rumi Bekwe.
Okay.
So for those asking, is in Rumi Bekwe, Nembe Road. Very easy to find, and it's also on your Google map. Just put Lakeshore and you'll find it there.
All right, so case settled. We are at Port Harcourt, and for now, although the foundation doesn't have a physical office at Port Harcourt, the Lakeshore office at Port Harcourt is readily available to, navigate you to us we are not restricted by location to offer the support we need to offer to you. Should it be treatment support, we have sponsored patients outside Lagos, even down to the far north. We've been able to sponsor patients' treatment in this area, so we're not restricted by location. So before we wrap this up, I would like to briefly invite Dr. Toluwanimi, who is on the research team at Lakeshore Cancer Center, to give us a brief, just in a minute, to give us a brief summary on the ongoing research around financial navigation for patients at Lakeshore Cancer Center. Dr. Toluwanimi, are you ready for us now?
Yes, I am. Good evening, everyone. Thank you, Amanda. Thank you to all our speakers for a very enlightening session. So very quickly, currently at Lakeshore, we are currently working on a study that is supposed to evaluate the impact of financial navigation on cancer care in Nigeria. So basically, in simple terms, financial navigation is just us trying to help prepare patients for the cost of their cancer care. So when we have new patients coming, we want to have somebody that will walk you through your cancer journey. But this person is going to be somebody that is in the financial system. So they want to know what you can afford, how much care, and just to actually navigate how we are going to get care. So for this particular study, we're not giving any we don't have any financial commitment to it. It's just us offering some form of help. And the help can come in form of directing you to a place where you get something or one of your screenings or costs at a reduced cost or at no cost, depending on what we have available and depending on what your cancer journey or your treatment is looking like. And basically, to participate in this study, you just have to be 18 years or older and have a new diagnosis of breast, colorectal, or prostate cancer within 6 weeks. So we are particular about breast, colorectal, and prostate cancer. And your treatment has to be going on at Lakeshore. And of course, we need your consent. So if you are consented to doing this study, you are 18 years or older, you have a new diagnosis of breast, cervical, or prostate cancer, and your treatment is going on at Lakeshore, you are very eligible for this study. So you might be wondering, why are you doing this kind of a study and all of this? So basically, like everything we said today, I heard Dr. Easy say cancer treatment is very expensive. And there's no need. If you come to Lakeshore, you would also know that there's a cost effect to everything that you do. So we just want to look at ways to ease our burdens or make our out-of-pocket costs, to see ways that can make our out-of-pocket costs of cancer care lesser. And yeah, it would be nice to have as many of us that would like to participate in this study. You can either reach out to info@lakeshore.org, or you just reach out to the flyer that Amanda had displayed on the screen, or better still, just send a DM to Lakeshore CC or Foundation for Cancer Care, and we'll be able to direct you. Thank you very much, everyone, for joining this session.
All right, thank you very much, Toluwanimi, for sharing that with us. Okay, Dr. Oge has her hand raised. Dr. Oge, please go ahead. And while Dr. Oge is speaking, a poll will be launched shortly. Kindly attend to that. Dr. Oge, you can go ahead, please.
Yes, so thank you very much to everyone who has been here this afternoon. Importantly, thank you to Dr. Easy, Mrs. Ronke, and all the speakers and participants. I just wanted to add to what Dr. Toluwanimi just said about the study that Lakeshore is embarking on with our partner, Health Systems team in Chicago. Apart from the participants who will join the study who are interested, we are actually looking beyond that to those who can collaborate, who can sort of support the process. So whether it's HMOs, whether it's other NGOs and foundations, just to see from the study whether this is a feasible way to help patients manage their costs. So we're actually collaborating with IFE as well, the team at IFE. So it's actually not just Lakeshore, but a joint collaboration, because clearly from what we've listened to today, financial navigation is, or rather financial toxicity is a huge, huge burden. So with the findings of this study, we're hoping then we have some sort of blueprint that can be replicated, not just for Lakeshore, not just for Ife, but beyond. So please reach out to us if there's something you've heard from this small summary and you need to know more. You don't have to be a cancer patient. If you're just interested in knowing more about this study, please reach out to us. Thank you.
Okay, thank you very much, Dr. Oge, for that. So before we call it closed, does anyone have questions, comments to make before we close this session finally? The poll is currently up. We would like you to give us your feedback regarding the session. And also, we encourage that you follow us on all our social media platforms. We're on Instagram, Twitter, LinkedIn, YouTube, Facebook, and coming soon, we will be on TikTok. So thank you, everybody, again, for making out time to be part of this session. This session will be available on YouTube in case you'd like to relive the session or share it with your friends, families, or colleagues who are not able to attend. A link will be sent to you via email once the session is ready and uploaded. Thank you once again for joining us. Do have a wonderful evening. Bye.
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 Bye, Amanda. Thank you.
Bye, everyone.
Bye.
Bye, everyone. Bye.
Bye, everyone.
Bye.
Thank you very
Yeah.
much.
Uniform.
Ano siya?
Uniform.
Ano siya?
Uniform.
Ako lang